Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Anambra State Government commences third phase of vaccine campaign, starts administering booster doses. Taraba State Assembly seeks more funding to mitigate impact of COVID-19 variants in the state. And South Africa begins a Johnson & Johnson booster shot efficacy study as its health minister takes a second shot of the vaccine. Thank you for joining us. The World Health Organization, WHO, says the COVID-19 cases in Africa are doubling every 5 days. In a statement on Tuesday, the organization said 83% surge in new COVID-19 cases during the past week in Africa, driven by the Delta and the Omicron variants, is causing fewer deaths than previous surge. It also said more waves may arise because the continent may not reach 70% vaccine coverage until August 2024. WHO said the speed of the spread is fast, but deaths remain low and even dropped by 19% last week compared with the previous week. According to Dr. Matshidiso Moeti, WHO Regional Director for Africa, we are cautiously optimistic that deaths and severe illness will remain low in the current wave, but slow vaccine rollout in Africa means both will be much higher than they should be. Well, let's bring you more on the COVID-19 update.
730 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 10 states and the FCT, indicating an increase from figures reported earlier. Lagos led the chart with 431 cases. The FCT logs 174 cases. Rivers had 38, Ogun 32, Akwa Ibom 25, while Anambra registered 11 cases. Other states, including Katsina, Bayelsa, Niger, Kano, and Ekiti, registered a single-digit infection. The new tally has increased the total confirmed cases in Nigeria to 218,596. 1,178 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 211,254. There were no additional deaths resulting from COVID-19 complications in the last 24 hours, leaving the fatality toll at 2,983. More than 8 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 4 million persons have been fully vaccinated. In Africa, there are more than 8.9 million confirmed cases and over 225,000 deaths recorded across countries on the continent. The total global confirmed cases have surpassed 271 million, while deaths are beyond 5.3 million.
Over to the southeast, where the Anambra State Commissioner for Health, Dr. Vincent Opala, has urged the people of Anambra State to be part of the ongoing COVID-19 mass vaccination exercise, as enough vaccines have been made available to cater to the population in the state. He said this during the flag-off of the COVID-19 mass vaccination exercise at the Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, Amako, Oka, where booster shots are also being administered.
At the immunization cold room of the Chukwuemeka Odumegwu Ojukwu University Teaching Hospital in Oka, the third phase of the COVID-19 vaccination exercise is being flagged off. The Executive Secretary of the Anambra State Primary Healthcare Development Agency is eager to ensure that everyone in the state is vaccinated.
In addition to 330 primary health centers representing the wards, general and teaching hospitals, we have also accredited 50 private health facilities to conduct COVID-19 vaccination. We have also included 16 special centers. Having brought the vaccination to our doorsteps, it is hoped that our people aged 18 years and above will embrace this opportunity, especially during the Christmas festivities.
The World Health Representative is sad that Nigeria had vaccinated a mere 3% of its population as at December 2nd, 2021.
All countries we're giving targets of vaccinating 10% of our population by the end of September 2021, 40% by the end of December, and 70% by the end of June 2022. Unfortunately, Nigeria has barely vaccinated 3% of our population.
The state has created more vaccination sites and is encouraging residents to come for booster doses.
Since we just got approval to commence administration of booster doses of COVID-19 vaccines, we also encourage our people to take their booster doses if it's been 6 months since they received their second dose. There is currently an app that allows the vaccinated to verify and validate their personal information, such as name and date of birth. The app allows you to correct damaged QR code and secure your vaccination record against impersonation and other fraudulent activities.
The vaccination exercise begins with the commissioner taking the booster dose. Other beneficiaries who receive the vaccines free of charge expressed their opinions.
It's fine to me. You didn't have any side effects on me, so I feel good.
For me, I feel everyone should be part of this COVID-19 vaccination exercise. Try to take it. For now, there are no side effects that we've seen or recorded.
The exercise winds down for the day, with the state commissioning a 50 kVA generating set and 707 megaphones for social mobilization donated by UNICEF, which will be distributed to the local government health authorities. This phase of mass vaccination should end on January 6, 2022.
20 days after the presentation of the 2022 budget, the Taraba State House of Assembly says it is exploring other revenue-generating sources to tackle the Omicron variant of COVID-19 should its spread continue into the state. Well, this follows the passing of the 146 billion naira 2022 budget into law without consideration for the COVID-19 pandemic and hiking up by an additional 3 billion naira. The Speaker disclosed that the Assembly is on alert to continuously monitor the spread of the pandemic.
We are being mindful of the fact that the COVID-19 pandemic is still available, and another new variant, Omicron, is the wave is all over. But what the House Assembly did was look inward and look at other revenue centers, having it in mind that we might, as a nation, not even as a state, face some challenges. So we have to look inward and to discover other revenue centers that have not been exploited, and we feel that we could use them. So the budget itself is predicated on those revenue centers.
Well, the new coronavirus variant Omicron is spreading across the globe at unprecedented rates. The World Health Organization, WHO, has warned that cases of the heavily mutated variant have now been confirmed in 77 countries. Well, to talk more about this, joining us in our Lagos studio is Vacinating. He's a public health physician and also a pharmacist. Thank you for joining us on the program.
Thank you for having me.
All right. First, is there anything conclusive about the Omicron variants? I mean, because we've been hearing about how it seems vaccines were not enough in terms of, vaccines, yes, and then the Omicron variants. People could still get Omicron variant even though they were vaccinated, and now we're hearing studies saying a booster shot is effective, 70%, South Africa, 75%. But what do we know that's more certain about how Omicron spreads?
Okay, for Omicron, we can categorically say for now that the mortality is far lower than the Delta variant. We can also say that the spread from one person to the other is higher than the Delta variant, and of course the doubling time is far more than the Delta variant. The truth about Omicron is that we can't really say for now the effectiveness of the vaccine, but we know that Pfizer COVID-19 vaccine seems to provide some level of protection against it, especially when administered as a booster dose. But scientists across the world are still studying. We are still trying to see what will come up in the next few weeks. Even in terms of the mortality, we cannot just conclude, because if you look at the countries under study with regards to the mortality, looking at South Africa, Africa generally did not really suffer much, even throughout the pandemic. So by the time the Omicron is quite prevalent in countries like the US, the UK, we are seeing a lot of cases now, then we can say categorically whether or not the mortality is high. But for the vaccines, we still believe that the booster shot provides some level of protection against Omicron.
So it's interesting you mentioned Pfizer, which is an mRNA vaccine. So Ogun State says it started administering the booster, and it's saying regardless of if you've taken other vaccines like the AstraZeneca or Moderna, you can take the mRNA booster vaccine. Why is this?
Well, because of the technology used. mRNA vaccines are actually messenger RNAs compared to virus variants like AstraZeneca. So when it comes to handling different kinds of variants, it might just be difficult for the other kinds of vaccine to provide that level of protection. But for mRNA, it works with a technology that stimulates the production of a protein. So whatever protein it produces actually targets close to whatever variant is coming up. But what we are saying is, even though it's more effective, much more effective compared to the AstraZeneca and the other ones, but we're looking at the fact that with more mutation and with the development of more variants, we might probably get to a point where some of the existing vaccines may not be that effective against it.
So for people who took first two shots, AstraZeneca and Moderna, how do you convince them that the shots they've taken are not inferior if you're insisting that a Pfizer or an mRNA vaccine should be the booster?
No, simply, it's not just, this is not the first time we are talking about booster doses. Even in many other vaccines that we've taken in the past, before COVID-19 vaccine, we always talk about booster after a period of time. So what booster basically does is to re-stimulate the immune system against a particular pathogen. So in this case, we are saying that, look, if you look at the profile, the efficacy profile of all these vaccines, you still see that our mRNA were far better compared to the other ones. So that's why we're saying that against newer strains, that mRNA has a better ability, to provide that protection. And that is why we are, recommending that for a booster. And apart from that, even the studies that have been carried out everywhere, South Africa, UK, everywhere, still points to the fact that mRNA is much more effective against newer variants of the virus. And that's why we need to take that as a booster.
Where would you place the J&J vaccine and then the booster?
Well, J&J vaccine, the booster dose comes as a second dose of J&J. And studies so far has also shown that J&J, the second shot of J&J as a booster dose is effective, even against some of the new variants that we've seen, the Delta variant that we've seen before. Although we don't have sufficient study to show the effectiveness with Omicron. And we are hoping that in the next few weeks, because as I speak to you now, studies are on the way, and within the next few weeks, we are going to get some more information about Omicron and J&J. But for now, we are recommending that J&J's second dose should be given as a booster for the first dose. And all the boosters we're recommending 6 months after the first dose. All
right. We're going to go on a break now, but, perhaps you should mull on this question, and that is that, we are starting our booster doses, shots at this point, but then we still have millions of people who are yet to even receive a shot of the vaccine. You can tell us why when we return. Please stay with us. Welcome back to the program, and we've been talking to public health physician and pharmacist, Vaccinating. Thank you for your patience. So, I mean, back to that last question, this direction, considering the population unvaccinated, should we be proceeding with the booster doses?
I think it's actually not really wise, if you ask me, for us to focus on booster doses when we have a large population that has really not received even a single shot of the vaccine. I think we should channel much of our energy to making sure that we get people to take the first dose and, of course, the second dose of the vaccine. If you look at the percentage, we are barely at 7% of the population, and that's really poor. That's far away from the 70% herd immunity targets that we have. So I know that a lot of us are trying to be a bit ambitious. We are trying to see how we can get the booster dose. We want to be fine. We want to be safe. But then I think it's important that we look at covering more people, because when you leave a larger chunk of the population unvaccinated at all, you keep a cluster of people that are a threat to the rest of the population. So I think we must strengthen access to vaccination for a large portion of the Nigerian population that have not really taken either the first or the second or even both of them. And then we can then look towards, the booster dose.
And according to the WHO Africa region, they're saying it's not until August 2024 that Africa might be 70% fully vaccinated, and this is at the rate we're going. Let's talk about Lagos, especially with the cases it's been recording so far. I mean, it's close to the holidays, and then we have the highly transmissible Omicron. What extra measures should we be taking today to stop, the fourth wave from spreading?
So for me, it's a very big concern for me, given the fact that we are going to the Yuletide season with lots of celebrations, and you're going to see lots of people in crowded places and all of that. And yet, at the same time, we are having a highly transmissible version or variant of COVID-19 virus. I think what we need to do at this time is we need to get Lagosians or Nigerians as a whole to take this vaccine. And of course, we need to re-emphasize the need for Nigerians to adhere to the public health measures. There is no way in the world that we would say that taking 2 shots, even a booster dose, will protect you 100% from the virus. So that leaves a room for people to still adhere to the public health measures. Unfortunately, you move around the streets of Nigeria, and then you see a lot of people. Probably the only person that wears a mask is seen as the odd man out. It's not supposed to be so. We are still in the midst of the pandemic. We are still very much in the midst of the pandemic. And so Nigerians should learn to take responsibility. During this Yuletide season, let's make sure that we avoid crowded places. We will have more Christmas, more Yuletide to celebrate if we remain alive. And the only way we can guarantee that is to make sure we adhere to the public health measures, hand sanitation, hand hygiene, respiratory hygiene, and avoidance of crowded places.
We always appreciate your time on the program. Thank you so much, Dr. Vaccinating, for joining us on the program.
Thank you for having me.
Well, over to South Africa, where the country has welcomed news of its removal from the United Kingdom's travel ban imposed late November, which also included other Southern African countries and then Nigeria. The ban came after South Africa had discovered a new COVID-19 variant, Omicron, which has now been detected widely across the world. Meanwhile, South Africa begins a Johnson & Johnson booster shot efficacy study. Its health minister has taken the second shot of the vaccine.
South Africa's health minister, Dr. Joe Phaahla, took the Johnson & Johnson booster shot at the Zuid-Afrikaans Hospital in Pretoria as part of the Sisonke study program on health workers.
At this stage, there is a whole lot of evaluation of the efficacy and length of protection of the vaccines. Firstly, we know that definitely the vaccines protect us against especially severe illness with the COVID. But with the debate about how long does the immunity last, we felt that we needed to do this, give the healthcare workers the first opportunity to have additional protection, but at the same time doing it through the Medical Research Council as part of the second study, so that at the same time they can be able to assess the difference in terms of the immunity from the first dose, and then when you get the second dose, the booster dose.
Dr. Patla appealed to everyone within the approved age range to take their vaccines, as this has proved to be effective in reducing chances of severe illness from COVID-19. In South Africa, the regulatory authority has given approval for the third Pfizer doses to be rolled out in January 2022, starting with the aged from 60 and above. South Africa is in the grip of a fourth wave fueled by the Omicron variant of COVID-19 and has seen numbers surging, although fatality figures are much lower than in the previous waves. We asked the minister if South Africa has recorded any Omicron-related deaths.
As we said, not every test is subjected to sequencing. So at this stage, we'll have to get our analysts who analyze the deaths to see whether some of those can be attributed. We don't know at this stage, but I think in a few days' time we should be able to.
Meanwhile, shortly before the minister's photo-op event, an anti-vaccine group was out protesting in Pretoria, heading to the seat of power, the Union Buildings, as well as the British High Commission, and have headed back to Pretoria Court this Wednesday to seek a hearing date for an urgent application they filed a few weeks ago opposing the vaccination of children in the country. From Pretoria, South Africa, Betty Dibia, Channels Television News.
Meanwhile, WHO Chief Dr. Tedros Ghebreyesus has called for countries to step up measures to curb the new strain with a combination of mask wearing, social distancing, as well as vaccination. According to him, countries should have learned by now that we underestimate the virus at our peril. Even if Omicron does cause less severe disease, the sheer number of cases could once again overwhelm unprepared health systems. Well, here's more on the global update.
Hello, everyone. Thank you very much.
The World Health Organization says all countries need to step up measures against the highly mutated coronavirus variant, which has been spreading at an unprecedented rate and probably already in most countries.
77 countries have now reported cases of Omicron, and the reality is that Omicron is probably in most countries, even if it hasn't been detected yet. Omicron is spreading at a rate we have not seen with any previous variant. We're concerned that people are dismissing Omicron as mild. Surely, we have learned by now that we underestimate this virus at our peril.
Well, South Korean Prime Minister Kim Bong-kyung says the government is considering plans to further tighten countermeasures in a bid to curb the spread of the coronavirus. South Korea reported 7,850 new coronavirus cases over the past 24 hours, its highest daily total, as breakthrough infections among those already vaccinated continue to spike, with the number of patients in serious condition also reaching a fresh high of 964. The French government says it expects to see around 4,000 patients in intensive care with COVID-19 by the Christmas holidays. Over the past 24 hours, the country reported 63,405 coronavirus infections, the second highest number of new infections this year since April. Authorities also reported 158 COVID-19 deaths, pushing the death toll to 120,832. German Chancellor Olaf Scholz has vowed to win the fight against the coronavirus pandemic, imploring Germans in his first major address to the parliament to get vaccinated as the only way out of the crisis. He says there are no red lines for his government in tackling the fourth wave of the pandemic, which experts say is largely driven by a relatively high percentage of unvaccinated citizens. Elsewhere in Europe, Spain has kicked off its COVID-19 vaccination campaign for 5 to 11-year-olds. Spain's Health Commission approved on December 7 vaccinations against COVID-19 for children under 12, following a recommendation by the European Union's health regulator late last month. The decision comes as a country with 90% of people aged 12 and over already fully vaccinated seeks to address a rise in COVID-19 cases. And finally, Australia has reopened borders to vaccinated skilled migrants and foreign students after a near 2-year ban on their entry. The emergence of the new Omicron variant forced officials to delay the reopening by 2 weeks after health officials sought a temporary pause to get more information about the strain, which so far appears to show milder symptoms than other COVID-19 variants.
Continue to take responsibility. You can visit our website for more updates, also a better understanding of the pandemic, and you can find some breaking stories as well. It's channelstv.com with news at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Mwaka. Stay healthy.